Welcome to Heart Nurses, brought to you by the Preventive Cardiovascular Nurses Association. PCNA's mission is to promote nurses as leaders in cardiovascular disease prevention and management.
I'd like to welcome our audience today to our conversation with Linda Park. Linda, could you introduce yourself to our audience?
Sure. Hi, Geraldine. I am an associate professor in the School of Nursing at University of California, San Francisco. And I also hold a position in the San Francisco VA as a research health science specialist. And I also practice as a nurse practitioner in hospital-based cardiology, cath lab area at John Muir Medical Center in Concord, California.
We're so glad that you have joined us today, and our conversation is going to center around digital health for cardiovascular disease. So I'm going to go ahead and turn it over to you and let you kind of tell us what you think is most important in that particular part of our field.
Yeah, well, I'll just say that digital health spans lots of things. So it's really an umbrella term for what we previously called eHealth, mHealth, telehealth. It kind of is an umbrella term, so I'm going to speak a bit broadly today, but it captures all the different technologies that are patient-facing, provider-facing, and also the back end of what happens to integrate technology with patient care, analytics, all that. So it's a huge space. It also includes AI, which is also, a hot topic, and hopefully will change the world in good ways, health information systems. So I just wanted to talk about it today in the context of maybe patient and provider only, because capturing everything is probably a bit too overwhelming.
That sounds like a very excellent plan. Why don't you start our conversation talking a little bit about patient-facing pieces?
Sure. So I'll just talk in the context of working as a provider in the cath lab space, and patients coming in with their AFib ablations because they captured an arrhythmia on their smartwatch, that kind of thing. So there are these patient-facing technologies that are really helpful for patients to monitor their health. If they had some palpitations, they get a smartwatch, that kind of thing. Digital health also helps when you are capturing your step counts, as simple as that. And we all do that whether we want to or not by carrying our cell phones with us. So all of these technologies, I think they help us in lots of monitoring, capturing data ways that are seamless, and we don't have to press anything, or it just kind of does it in the background. And then there's also these sensors that we wear, and so we put these implantable loop recorders that monitor your rhythm that is otherwise hard to capture. We have these, skin patch technologies. There's a very fun, evolving field. However, I think the concern is being able to provide it for all people, all populations, all communities, and the concern in being who are we leaving behind in offering these really high-tech technologies, but people who maybe live in rural communities or who don't have other ways to access health, it feels like that divide is getting bigger and bigger. Just the simple idea of having Wi-Fi and having access, some patients that I enroll into my clinical trials, they have to go to libraries and community centers to get access to Wi-Fi, so we can't necessarily expect them to be able to capture data remotely because they don't have that. We have to offer them a Wi-Fi, that kind of thing. So a lot of potential there, but also some concern that we are also widening that divide that's already here.
We're going to take a quick break, and we will be right back.
For more education, resources, and tools for your clinical practice, visit PCNA.net. You'll find CE courses, patient handouts, and more, all free to access. Visit PCNA.net.
We're back for more discussion with Linda Park. And Linda, right before our break, you were talking about what the benefits are from the patient side, but I'm hoping you could address what it's like from the professional side to have this mobile eHealth, telehealth, all of these kinds of opportunities to connect with and get information from our patients.
Sure, yeah. I think given the potential of digital health, we've seen it really realized in remote patient monitoring, that kind of space. But I think the day-to-day outpatient encounter, we sometimes don't know what to do with those data. It's so hard to squeeze in all that you need to squeeze in into your 10-minute visit and then the 5-minute charting, and everything gets tighter and tighter, and the opportunities for you to really look at the patient data, like pages and pages of blood pressure, and screens and screens of step counts and things like that. I think the provider needs to come to terms with the fact that these data are here to stay and how we are going to incorporate those data. So hopefully that transition will be much easier for providers just to access and to make sense of. But I think that has not come yet. The effort that patients are putting in to the digital health has not necessarily converted yet. I'm hoping we can get there soon with the help of perhaps engineers just being able to help us integrate those patient data into something that makes sense for the clinical provider to take action on. So, if you have algorithms of something that the patient brings in as far as step counts, like you can counsel the patient, well, you're falling in the range of 30% of what's recommended. So just being able to work with partners in terms of being able to look at analytics and make sense of it and make hard recommendations that are applicable and helpful for patients to take with them back home, and hopefully promote behavior change and adherence and all those things. Actionable items.
So like everything else in healthcare, we're looking at a team-based care situation where we're partnering with patients to get the information. We're partnering with our colleagues to make sure that we not only access but act on that data. Of course, it's a challenge when there are reams of data points that are coming into our lives, and I really am grateful to you for talking about that next needed step to make sure that we're not missing any opportunities, because it's nice to have the information, but if we don't use it, then it's no help whatsoever.
Exactly. You got it on the head.
We are so grateful to you for spending time with us today, Linda. We are really excited about the opportunity to have more individualized medicine by using these data points. And with you, we are holding out hope that that's going to happen sooner rather than later. This is your host, Geraldine Warfield, and we will see you next time.
Thank you for listening to Heart to Heart Nurses. We invite you to visit PCNA.net for clinical resources, continuing education, and much more.